The concept of seizure clustering is very poorly defined because nobody knows what it is. It's the way patients themselves describe, or their families will describe, I had a lot of seizures all at once, and then as soon as the doctor uses the term cluster, then they will talk about cluster. But whether it's 2 or 3 or 5 or 10 depends entirely on the individual. For some patients, the cluster could occur early in the morning and then they're done for the day, and that's good because they know they're done for the day. For others, it could occur at any time, and the whole problem with epilepsy is not knowing. Well, I think when you talk about what this does to a patient's life, you can't separate out having epilepsy from having clusters, because it would be similar to having one seizure that has a lengthy post-ictal recovery period. So whether it's multiple seizures that last 10 minutes or a prolonged post-ictal recovery period, it's the same issue to the patient. The bigger problem is if it's multiple seizures and consciousness is affected periodically, there may be a greater likelihood for falling and causing injury. And quality of life for people who have continuing seizures is very much impaired. And I can't say that it's particularly different for those with clusters, except for the greater danger of injury because they have impaired consciousness. Risk of injury is great. Many young children will have to wear a helmet, or some sleep on a mattress on the floor because that avoids falls. It can be devastating to the family. It consumes the entire family. So it's a tremendous family burden, which is considered an indirect cost of epilepsy that's not accounted for in the cost of the treatment. But it is great. Whether it's different for those with clusters depends on frequency, severity, and so many other issues. Indeed, a self-reporting number of seizures is very difficult. First of all, many people are amnesic for the event. They don't remember what happened unless there's something else. They know that every time they wake up on the floor and their mouth hurts, that was a tonic-clonic seizure. So family reporting, other people reporting is very, very helpful. The ability to count time is poorly done by all of us. How long have you been waiting in line? Oh, 15 minutes. The next one says 3 minutes. And it's very difficult to self-report duration of any kind of event. And lastly, how many seizures occurred? Was it one? Did it evolve from that tingling feeling that was technically a simple partial seizure into a complex partial seizure and then perhaps to a tonic-clonic seizure? Was that 3 events or was that all one event? So as the progression of the seizures as it travels across the brain is one issue in counting events, and the other is just being able to separate them. One thing that would be very useful for anyone who has epilepsy, whether it's regular seizures or clusters, but particularly clusters, is to keep a good record. And I certainly recommend an online web-based diary on www.epilepsy.com. It's free, it's available, just sign up and record the types of seizures that you have. Record your medicines. And then when a seizure occurs or a cluster, note the date and the time, how many seizures you think are in the cluster, how long you think it lasted, and so on, or the individual seizures. Your doctor will then be able to compare the seizure events with any changes in medicine that have gone on so that he can see, oh, I raised your dose here and you had fewer seizures after that. Oh, you had clusters, I started this new medicine and now you're not having clusters. But you can see the timeline relationship with all these events, and it's exceedingly helpful to the doctor and to the family to understand which meds are working at which dose, which you don't have if you simply go into the doctor and say, well, I had 3 last week. I think I took all my medicine. Or I think it was 3, I'm not sure. Maybe it was only 2. But by recording it when it happens, you have the information. You also have the opportunity to record the side effects that may have occurred, because the doctor needs to know that in relation to the dose changes.